calling the council back into order, and we're going to have a Board of Appeals interview. It's for two people who have applied for the position. Mr. John Pentecost, who is the current chair of the Board of Appeals, and Ms. Laura Seminario Thornton. I believe I'm pronouncing your name correctly, and if I'm not, let me apologize in the beginning. But what I'm going to do is I will ask one of you the first question, and then the other person the next question to be first. So we'll go back and forth in order to be fair. And the first question that we have is why do you, and then after I'm finished the set number of questions, then if any of my colleagues has questions, they will ask as well. And the first question is, why do you want to become a member of the Board of Appeals? And for the current chair, Mr. Pentecost, why do you want to continue serving on the Board of Appeals? And Mr. Pentecost, we'll ask you first, please.
All right. Well, thank you, President Katz and members of the council. First of all, let me thank you for the 7 years I've had on the board. Walter Booth unfortunately passed, and I took over his term and then continued for that. So I'm looking forward to another 4 years on the board because it really provides an opportunity for me to continue to serve the county. I've been, especially with the COVID-19, I found that this service has really stabilized myself and has also provided us the opportunity with MS Teams that we've been using to continue that service. So I think we're on a good path, and again, I enjoy this. It's right in my mainstream of my work for my life, which was housing and community planning and development. So this is a very comfortable, not comfortable in the sense of easy, but comfortable in the sense of something I feel qualified with and enjoy doing.
Thank you. Ms. Seminario Thornton. You're on mute. I think most conversations anymore start off either you're on mute or am I on mute? So that's exactly right. Yeah, I think most conversations now start that way. Please, if you could, same question.
Good morning. Thank you so much for having me and the opportunity to serve the county. I am an immigrant living here in Montgomery County for about 16, 17 years. I always try to help people and serve my community in the best way. Before, I was serving as a commissioner in the early childhood education because I was so interested to help families in need of childcare. Right now, my time was off, so I received this email inviting me to participate, and I applied. And it is very important for me, education, housing, and the community. That is the main thing that I apply. Thank you so much for listening.
I was having a little technical difficulty there, so I had to, but I did hear what you had to say, and I appreciate it.
No problem. Thank you.
And you'll be the first person to answer the next question. What is what in your background prepares you to serve on the board? And that would be, yes, Ms. Seminario Thornton.
As I mentioned before, I am an immigrant in my country. I study accounting. And then when I came here, I found the language as a barrier to get a job. So I went back to college. I did early childhood education and general studies. And then right now, I went back again to university right now to get it in political science and improve my language skill too. So I really like it to be inclusive in my community. I think language is very important for everyone in the community, and I really would like to serve my country and the different groups that are in our county.
Very good. Thank you. Mr. Pentecost, same question.
As I mentioned, I had a career with HUD, and back in the 70s, I was actually the community development rep for Montgomery County, which goes, shows my age, I'm afraid. But so housing and community development are sort of in my wheelhouse, but I think also my familiarity with most of the neighborhoods. In part, I knew a lot of them before. I've served on the board, but in my business, which you may remember is a notary signing agent, I get to see a lot of the county and a lot of the neighborhoods. So I have a fairly good sense of the county as well.
Very good. Thank you. Ms. Pentecost, you're going to be answering the next question first, please. Tell us about a time where you have helped to achieve consensus among groups or individuals with differing points of view.
Well, I appreciate that question, and as you know, there's a couple of things that have happened. One, almost every week we have a variance, and I have to tell you, some of those variances tend to be contentious. We seldom have them go to the circuit court, but I think we have actually one now. They're controversial, and people have different perspectives on why the variance should be granted. So the effort I've made, and the board in general has made, is to stay focused on the legal considerations, to stay focused on the legal groundwork. And we do that by, before the variance even is heard, we have a variance statement that we make sure that our variance petitioner, as well as the people that may be opposing the variance, fully understand what the ground rules are for granting a variance. And then we follow that line all the way through. And that has really maintained, I think, a fairly low level of returns or public hearings or further contentiousness about the variances. The second one was we got Comcast out here in rural Montgomery County, and the other point of contention there was trying to convince people to sign their easements, because it was an unknown impediment to getting Comcast. And so part of my effort was talking with people on a one-on-one basis and convincing them of the benefits of for themselves as well as for the community of getting high-speed internet.
Very good. Thank you. Ms. Seminario Thornton.
Well, I really believe in diálogos, open mind, and respect. We can have different opinions, different ideologies, but respect is what makes us different. We are all humans, and respecting others in any way will be making the difference. And if we are working in groups, the most important is the consensus, to get it even when we are not agree or we don't feel like it walk that path. We have to respect the majority.
Thank you. And the first question, you will be answering the next question first, please. Please explain your understanding of the role of the Board of Appeals and how it serves our community.
Mainly what I read in the website was the board reviews and design applications for modifications or special exceptions based on the legal standards and the standards that Montgomery County have on the law background. So a few years ago, I had my own experience. I wanted to do a remodelation in my front home. I applied for my homeowners association, and they denied. So I didn't do anything. But I didn't know that this board exists to help me with do further investigation or further application. So that one was the interesting thing that making me apply and to make this spread about the work that the board have in our community.
Thank you. Ms. Pentecost, same question.
Yes, sir. Well, obviously, the board represents the council's roles in disputes, and if it wasn't for us, you have a lot more on your plate, unfortunately. But Our dispute settlement is our principal role, and we basically represent the council's role in dealing with our citizens dealing with the executive branch. And I will say that most of our work is special exceptions, variances. And I'll also tell you that we've had a really great relationship with DPS recently. I mean, they've just really been doing a great job with us. So we don't look upon ourselves as overturning a DPS decision. We look upon us as working together to help our citizens achieve what they want with their properties. That's about it.
Thank you. Ms. Pentecost, you'll be answering the question first for this next question. The Racial Equity and Social Justice Bill became effective on March 2nd, 2020. And on June 16th, 2020, the Council passed a resolution declaring racism a public health crisis. How would you position the board to work on racial equity and social justice issues?
That was a question that actually gave me a little time to reflect on one of the major concerns that we have in the county as well as nationally, which is NIMBYism and our whole integration of communities in our society. And I think that what the critical aspect here is self-awareness. It really is being aware of our own biases and prejudices. And after that, you begin to start working on how do I make sure, does one make sure that the board itself is not feeding into that kind of institutional racism, that desire to prevent things from happening in their community that are perfectly legal, may be desirable, but may not be comfortable for people. And so I see our role as following the law and making sure that law is followed, which does require that we are not biased and prejudiced. So I think I think we have a strong role there not to feed into any continuing racism because, in truth, we're a reactionary group. We react to people. We're not out there promoting it. But I think that through the actions that we have, the questions that we ask, the whole sense of the board has to be that we are not going to tolerate overt racism or bias.
Thank you. Ms. Seminario Thornton.
Well, I never feel that my race or ethnicity will be a barrier or level me in any kind of way. So based on that, I respect everyone. I am very inclusive with all human beings. It's not about race, it's not about ideologies, it's about respect. When we respect, we can maintain a dialogue. And I think we here in Maryland and specifically Montgomery County, we have a variety of many ethnicities that we are working together. As a child care, I serve the community with all families, connections, and I really like it. I think respect is the base for every relationship, for every dialogue, and we have to apply in any kind of settings.
Thank you. And Ms. Seminario Thornton, you will answer the next question first. It's the last question on this list. Are there any potential conflicts of interest of which we should be aware? Will you be able to make the time commitment required for service on the board?
At this moment, I think I don't have any issue. I really would love to participate in the commission, and if something coming, I will notify immediately to the commission, to the board, and I will try to do my best to do my schedule work with what I am trying to serve right now.
Thank you. And Mr. Pentecost, the same question, please.
Yes, well, no conflicts. Curiously, I think, President Katz, I think you're the only person that I know that I've actually done a closing for in the 7 years that I've been there. And that
I think
really
you
is
should
not a crime.
explain it was closing on a refinancing of my home. I mean,
Right,
yeah,
right.
yeah.
So that's my current other business. It's now in abeyance with COVID-19. And yes, I do have the time and desire to continue serving on the board.
Thank you very much. And getting back to the time that you came to my home to settle on the refinancing for my wife and myself, it was very pleasant to see you, and I was very surprised to see you that day. I didn't realize that was your line of work. So, anyhow, and with that, that's all of our formal questions. I don't see any questions from my colleagues. Is that still correct? Well, thank you very much. We appreciate that is still correct. They have no further questions. Thank you very much. We appreciate your interest, and you will be hearing from us in the next couple meetings. Thank you.
Thank you so
very
much.
Next, we're going to go back to item number 5 on our agenda, and that's an action item, which is a confirmation of County Executive's appointee as the Chief Administrative Officer, Rich Madalino. Do any of my colleagues have a motion or comments?
So moved.
Yes, please.
Second.
Who was the person who actually made the first motion? I couldn't see you.
I think it might have been me, but not sure.
Okay. Councilmember Albernaz, Councilmember Rice, were you this person who made the second? Are there any comments? You have Mr. Madalino is on the line, and I think he doesn't have a handkerchief with him, but he's sweating a little bit, I guess. I see no comments. All those in favor of the motion, please raise your hand. Thank you very much. That is unanimous, and congratulations, Mr. Madalino.
Thank you very much, Mr. President. Look forward to working with you all. I appreciate your support.
Well, and we look forward to continue working with you as well. Obviously, this is not the first day you've been on one of our meetings, so we do appreciate it. And with that, we are running a full 10 minutes early, but I did see Dr. Stoddard on the line. Is Dr. Gales on the line as well? If not, maybe Earl, you'll start today.
Thank you. I got here early just in case, so I can go first this time.
Well, that was a very good idea, and this gives you an opportunity to actually do your presentation before any questions happen. So, and I'm assuming that as always, you and Dr. Gales are on a time commitment. So I am going to ask for the 5-minute rule for my colleagues for questioning. But anyhow, please, Dr. Stoddard.
I very much appreciate that, Council President Katz and members of the County Council. Thanks for having us back. To do a few comments today on some activities. Well, first off, let me say congratulations to Mr. Madalino. He's been great for us to work with. He has been great for us to work with, and I look forward to continuing with his leadership under these difficult times. There's a lot going on, obviously, as we well know. We continue. I know we have a executive order modification that you all will be taking up on Thursday that aims to address some of the challenges faced by our restaurants. We work with them, with chambers, to try and develop a process that would give us both the flexibility to allow certain late night alcohol consumption that we had previously limited, while also giving us the teeth behind some of the enforcement and some of the requirements to ensure the safety of our residents. And so those, we believe that the proposal identified within the executive order will allow us to do that. We know that it's important for our businesses to be able to operate, and this is an important part of their business model for the restaurants. And so we've been trying to make that accommodation, and we think we've struck the appropriate balance between the public health concerns and the economic interests involved. Continue to do the same thing with other industries. I spent, as I tend to have done, I spent a fair bit of time last night, about 2.5 hours, researching the science of indoor airflow, trying to educate myself further on how ventilation and filtration are increasingly important in how we address COVID-19. We've already begun work in our county buildings to identify places where we think we need to enhance either filtration or ventilation. As we get into the winter months where more people are going to be inside, those air exchanges and filtration are going to become an more important component of our response to COVID-19 than they were during the summer when more activities could be done outside. And so we're going to continue to look at that. It also will likely be a part of how we, make allowances for additional indoor activities based on the capability and capacity of the facilities to do air exchanges and/or filtration. Utilizing either HEPA filtration or other mechanisms to clean the air that's indoors. So more to come on that. I know, for example, we saw the release from the Only Theater. We know that our businesses continue to be devastated by COVID-19 and the restrictions that we've put in place. This is genuinely a no-win situation for most of us, where we're trying to make choices between public health and economics or other issues and other interests, and we're trying to do as best as we can to strike the best balance. I know that the hospitality industry has been particularly hard impacted by COVID-19 and has had the most has had limitations that have continued beyond many others, and so I know that this is an area we're going to continue to look at. We are going to sit down with the movie theater industry. We have a meeting that we're setting up already in place there. Similarly, I think the county executive met with the hospitality group yesterday. He's asked Dr. Gales and I to sit down with them in the coming days and weeks to try and hear out their concerns and see if we can find some additional accommodations there. We're going to keep looking. We pledge to keep trying to identify options that will make it safe for them. But I just wanted to make it clear that it's going to be extremely challenging for us. The other area I want to talk about is the food arena. We continue to see incredible need, even through the Salud efforts. We've heard an increasing demand from our community for food, and unfortunately, we've seen some changes in the way that some of the federal programs have worked, that we're actually seeing less support from the federal government in this arena than we have in the past. And as an example of this, the USDA Farm to Food Bag program had previously been providing the county between 23 and 26,000 food boxes a week. They informed us a couple weeks ago and took effect last week that they've reduced that down to 3 or 4,000 boxes a week. And so this is an area where we're going to become increasingly challenged. We still have resources from the previous allocation that the council has made, and so we're not in dire straits yet, but I think this is an area where we're going to have to make further investments from what we already have, but also potentially other dollars may have to come down the pike because, obviously I think we all agree that food is not an area where we can afford to cut corners or to skimp. People need to eat. That's a basic priority and one that we take very seriously and will continue to look at as we move forward. We are going to engage with our congressional delegation to attempt to address the shift in programming. We've been told essentially they're shifting priorities around and focusing on other areas of the country. We know that there are real needs here in Montgomery County. We've heard them. We've attempted to respond to them, and we are going to do whatever we can to encourage a return for the federal support. And if we don't see that, we'll obviously have to step in and provide the support that we know our residents need. So we continue we took a week off last week from meeting with the non-public schools. I know Dr. Gales will provide some additional updates on what we've seen in the intervening time. We're going to continue to meet with them on this Friday and the following Friday. Continue to provide guidance, answer questions for them to continue to be able to try and operate during COVID-19. We continue to see cases, and again, Dr. Gales give the more specific numbers, but we see cases in our non-public schools. We've seen a handful in MCPS workers and others, as well as Montgomery College. And so we've really seen seen it in all avenues as we've seen it across all avenues of society, and obviously this is going to pose a challenge. At the same time, we do continue to work with the Montgomery County Public Schools to try and find some reasonable options that allow for particularly special education and other students to have opportunities in our school buildings. We know that's important. We know that in-school education is the gold standard and one that we would want to get back to. We just want to make sure that we can do it as safely as possible over the coming months as we move through the pandemic. That's all I had for this morning. I'm happy to entertain questions until Dr. Gales joins us. I will text him in the intervening time so he can hop on quicker.
Councilmember Rice, please.
Well, Dr. Stoddard, thank you so much. You had mentioned before about your conversations and as chair of the Education and Culture Committee, it did surprise many of us. We hadn't heard anything from Olney Theater in terms of them directly reaching out, but I know that as a whole, one of the reasons why Councilmember Glass and I partnered together on the $3.25 million was to help stand up some of these organizations. And so I know that it's more about the long-term plan than it is about the initial funding. But I was actually a little bit taken aback by the fact that, we were kind of lambasted and, we were out here putting millions of dollars into the hands of artists all across Montgomery County, certainly understanding the challenges that we had when it came to the health concerns regarding opening. Can you talk a little bit, and maybe I apologize, Mr. President, maybe it's for Dr. Gales also, but talk a little bit about some of the concerns about the differences. Folks continue to say, well, there's no difference between us and a restaurant if folks are sitting, next to each other. And so why are they allowed to take off their masks and eat and drink, and you can't do the same in a theater? So for the millions that are watching at home, as Councilmember Jawando always says, can we just talk a little bit about that and why there seems to be a little bit of a delay in terms of moving forward with our arts and entertainment venues as opposed to some of the other venues?
Yeah, so there are a few different challenges that are posed by theatrical performances, and even a few more for things like movie theaters. I'll talk about them distinctly because I think it's relevant for both. So for our arts venues, number one, the length of a performance tends to greatly exceed the length of an average dinner. I think that's number one. That's not true in 100% of cases, but the average theatrical performance is going to be longer than the average dinner. And we know that more time indoors around the same people increases your exposure, increases your risk of infection. So that's number one. Number two, the actual, and I've learned this from a fair bit of research and conversations with the Department of Permitting Services over the last several weeks, the indoor air ventilation requirements for an auditorium or a theater are actually lower than those of an indoor dining location by an order of about 50%. And so I think it's measured in cubic feet per minute in air exchange. For an indoor dining location, it's roughly 7.5 cubic feet per minute per person. For an auditorium or a theater, it's roughly 5. And so that difference matters in terms of the risk of contamination of airspace. I think those are sort of the most seminal differences. Obviously, when you talk about movie theaters, obviously you add in concessions and then you add in the removal of face coverings to consume food and drink there as well. And so I think that those are the three biggest things that we've seen. Now, I know in the conversation that the county executive did have with the hospitality group yesterday, we are very closely watching this pilot in D.C. And if we can see lessons learned and experiences from what they're observing in D.C., I mean, we've shown that, whether it's for our faith community or our restaurants or others, we're willing to make changes and accommodations. We just don't like for our residents, we don't like to guess. We don't like to, be uncertain. And so we try and use data. And so obviously with a counterpart very close to us who's trying a pilot program, and we've tried our own pilot programs in other areas, we want to learn from their pilot program and see what they see in terms of their ability to keep indoor theater performance safe. And if they can find rules, recommendations, changes that work, we'll adopt those and we'll implement those, and we'll have our theatrical performances here as well. And so, I think that's where we're at. But the two biggest concerns for us are the length of the performances and the fact that the indoor air exchange in a theater or auditorium is lower than it is for indoor dining.
So I just really want to say thank you for that. I think that, again, us working together, watching the pilot, also understanding those kinds of nuances when it comes to air handling and the exchange ratios are certainly ones that folks may be able to make some changes to or enhance to try and bring them up to speed with where some of these others are. Some may not be able to, but that's certainly something that we can work towards. And so I'm very happy that that's out there so that folks know that those are the things that are some of the stumbling blocks that may be in the way, but also things we may be able to overcome. And so I really appreciate you continuing to work with the working group and hope that we'll be able to come up with some kind of resolution to help assist our arts organizations throughout the county as we did with the huge infusion of cash. So thank you.
And I just wanted to, I know your time is running short, but I just wanted to add, it's easy sometimes to identify the challenge. It's harder to find the solution in all cases. And so, the air exchange issue is one that we're trying to actually find an accommodation that is actually reasonable to implement, whether it be filtration and/or combination of air exchange improvements. But we want to have a explainable, defensible solution in addition to having identified the problem.
Thank you very much. Councilmember Giwando.
Thank you, Mr. President, and thank you, Dr. Stoddard, for all you do. Dr. Gales, good to see you as well. Two quick questions related to the restaurant changes that my understanding will be an opt-in with requirements. Are you at the point where you can, certainly we could do this next week, but could you just give some general outlines? We've all gotten a lot of questions about what will be required and just quickly when people will be able to apply and opt in, just the high level, assuming we take action Thursday.
Sure. And so there are a few requirements. Number one, we actually took a proposal that was made by a collaboration between the Bethesda Chamber of Commerce and several other particularly Latinx restaurants in the Wheaton, Silver Spring area. They put together a proposal of guidelines around just food service, safety, general things like that most restaurants are already doing. What we added to that are, so we would expand from 10 p.m. to midnight, and during the 10 p.m. to midnight hour, the business who opts in would be required to staff and/or hire a contractor whose sole responsibility is enforcement of the requirements inside the restaurant for that period of time. Essentially, what we realized is we can't be everywhere at once in these restaurants, and we needed the restaurants to help us in their own self-enforcement. The other thing it would do is it will allow us, first of all, it gives us a little more teeth in terms of we can take the permit away should we find people who are not following the rules. And frankly, even to opt into the program, you can't have been a place that's already had violations because we want to reward the people who have been good, safe operators in the past, which is the vast majority of our businesses, restaurants in Montgomery County.
So if you've had any violations, it's not a number. It's just if you had one violation, you couldn't opt in.
If you've had a COVID-19 site, not a warning, you had to have a citation issued, closure or something else like that. It's a limited number of businesses, but frankly, if you've had a citation issue, that means you've had warnings already before that citation. And then we also have some clear metrics that allow for the drawback of the program. I know Dr. Gales was particularly concerned about, what if this becomes a source of an increase? Maybe it's not the source, but maybe, it's one of many things that contributes to an increase. And so we identified some pretty clear metrics, 3-day test positivity that exceeds 3.25%, which we have not seen in a while, a 3-day average of cases that exceed 100, which we've not seen in a while, a change in our contact tracing data that indicates that indoor dining and outdoor dining are increasingly risky based on what we see on a weekly basis. We have not seen an increase in that recently, or a large number, 10% or more of the inspected participants having shown violations that would warrant closure. So we saw a lot of violations in the program. We pulled back on the program.
Great.
The permit will be up. It should be up this afternoon or early tomorrow morning, which will be in advance of your all approval. It should take, it's not a lengthy program process. It's essentially we list the rules, you acknowledge that you've read the rules and you're committing to abiding by the rules, you put in the business information. But what that also allows us to do is we know who's opted into the program and we know to whom we need to do further follow-up and enforcement.
Great.
That we're following through. So it's a very simple process, very akin to the expanded capacity that we had with our outdoor spaces into parking lots and,
Wonderful. I appreciate that. Thank you. And I'm going to try to just get one more question in, and that's helpful. Tomorrow or so, we'll take action. They can opt in, then you can spot check. I think that strikes the appropriate balance. And obviously, Dr. Gales, if we need to change it, we'll change it. But I appreciate you all working with the business community on that, and I know people will take advantage. On the food issue, that's very concerning. I've been hearing that from the Food Council and others that we're seeing increased need. What I'll say now is that we set up this effort to help partner with the private sector to raise funds. That's going to kick into gear, so hopefully that'll help. But I know we're going to have to do more here from the council, so just please keep us posted in real time, and I know we'll do that on the Food Council calls and what we need to do about making sure that our hubs and our partners have what they need to get food to our residents. That's such a critical need right now, especially as we head into the winter months when so many other bills are coming due. It's every day I'm hearing, the utilities, rent, all the things are kind of coming in at once, and we really need to be aware of some of these most basic necessities for our residents, which I know we all are. So thank you for your work.
Thank you. And you were right at 5 minutes. It's like you had a timer there. I'm impressed. Councilmember Raymer, please.
Thank you so much. Appreciate your thoughtful work, and Dr. Stoddard, your research on the air exchange issue. That's one that I have been, I haven't done that research myself, but I'm glad that you're doing it so that we can have that in-house expertise. The question I really had about these indoor event performances is how much does mask wearing, reduce the risk? As you and I had a brief exchange about it last night. I'm sure your response addressed the question, but when you're in dining, you don't wear a mask. I think that's the real difference that I perceive. And, rarely do you wear a mask. Whereas, there may be other types of indoor, openings where mask wearing can be strictly observed. But what I don't know is to what extent does that actually make a difference indoors? We know it makes a big difference outdoors. So I know you'll continue to look at that. My general question I wanted to ask you briefly touched on your work with the schools to support, their planning process. Can you just talk more about that now? Tell us, and this may go to Dr. Gales as well, but tell us how is the county government partnering with the schools broadly to figure this out? And I want to just ask a general question that I could ask you to address in your response. Private schools have reopened. There should be data from that about, COVID. Do we have the data tracking in place? Does the contact tracing system, produce what we would like it to produce to get a better sense of how safe that is? We're hearing about cases, but I think at one point I heard that there were cases, but they were not known to be caused by the school. They were actually just associated. They were there because a family got a case. Will we know whether the private school reopenings have actually caused cases themselves versus, it's because one of the family, there was whatever conditions might have caused someone to get it. So if you could please just describe for us how you're supporting the schools now in their planning process that has just initiated, and what could we do to better get knowledge from the private school reopenings? Thank you.
So a couple points. So we meet, Dr. Gales and I meet with Dr. McKnight and Ms. McGuire and others from MCPS on a bi-weekly basis, actually very similar to what we meet with the non-public schools more writ large on a bi-weekly basis. During those meetings, Dr. Gales and I discussed a whole host of issues from the county needs for testing in MCPS facilities to their needs for support in identifying safe opportunities in schools. And so we've been working very closely with them around they've been doing planning for a number of weeks, and I mean at this point it probably seems like I'm sure it is months around the programs that they're considering for November, and they have not finalized those plans, so I wouldn't want to talk about all the things that they're thinking about in terms of the planning process, because I know that they have to engage with teachers and staff and all those to make them helpful. But we meet with them and generally walk through all kinds of scenarios, whether we think that they need to do testing, how valuable would testing be to their programming, how many students roughly we think would be safe in a given space. Do we think it would be better for them to do it in a hub model versus every school and distribute further? All kinds of questions like that we've worked with them on. In addition, they do have an education mission area that meets on a biweekly basis on Fridays as well. And last Friday, they did meet, and they actually had representatives of the non-public schools provide presentations on their experience with hybrid education so far. And so to your point, there are lessons that are being learned in our non-public schools on a daily basis at this point. As I said, Dr. Gales will give an update on the number of school-based cases. And as you've alluded to, we have a constellation of COVID-like illness that ends up being not COVID, COVID-like illness that ends up being COVID, exposures, quarantines in school settings. In some cases, or a very limited number of cases, we have seen what we suspect is transmission in non-public schools. But it's very difficult to assert contact tracing or otherwise when there's community spread where exactly someone got an infection. You can think or suppose, and it's likely that it occurs in certain settings, but it's impossible to know because we just, there are many cases that we go through in contact tracing. Dr. Gales can speak much more about this than I can. There are many cases where we do not have a definitive origin point because the community transmission is not in a place where we can narrow it down with that degree of certainty that where we'll be certain. So,
Thank you.
I got most of those.
Thank you. Earl, I did receive a call this morning, and there's other council members who are going to jump in too, but I received a call this morning about talking about indoor tennis, and my office received it. And they're concerned why you have to wear a mask for indoor tennis. They believe that that's not necessary. Would you like to comment on that, please?
Dr. Gales, an avid tennis player, he's getting this question for sure.
All right.
I don't play tennis. I've never played tennis. I don't know what you're talking about. But before answering that, I would like to answer the second part of Councilmember Reamer's question.
Okay.
In terms of data. So as Dr. Steiner pointed out, there are two different categories that are required to be reported to the health department when there are illnesses. There's confirmed COVID cases, and then there's COVID-like illnesses. And so when those happen, they have to be reported to the health department and subsequent action is taken. And so, for example, in the setting of a COVID-like illness, the guidance from the health department is pretty much treating it as if it's COVID until proven otherwise. And so the recommendations in terms of quarantining, potential, closure of classes or schools, that kind of thing, that guidance would be provided pending a negative test result. And once that test result comes back negative and it's confirmed that it is not indeed COVID, the guidance is given to the schools that they're able to relax those provisions and go back to normal. And so we do track both sets of statistics. Since we last had our briefing last Tuesday, I counted, we've had 9 schools report cases in some capacity, students, staff, or teachers that turned out to be non-COVID illnesses. They were COVID-like, but were confirmed negative. We've had 10 schools that did report cases that were actually positive cases that involved students, staff, and or teachers. And in those settings, there are 2 of them that we received in the last 24 hours that we are looking into to determine if there is potential that would meet outbreak status. An outbreak would be more than 2 cases, either 2 confirmed cases or 1 confirmed case and another case that is a probable case or suspicious case. So we're looking into that. As you recall, in the past, we did have two instances where we did have that met the definition of outbreak, where we thought it was concerning for potential transmission within that setting. So we do collect data. I know that I received a question from one of the analysts that was sent by you and provided a response this morning. So we do collect data. We have not made that data public outside of our briefings here, and we've actually asked, we had a conversation with our colleagues at the state level to ask if they would be publicizing that data similar to how it was publicized for nursing homes and so forth. My understanding is that there will likely not be a state effort to report that information. And I think we can have a conversation offline with our legal team as well to make sure that if that were to happen on a local level, that it would be respective of the necessary privacy provisions. But I'd be happy to talk with you more offline of that. Now, to pivot to my favorite activity and favorite thing that I do for stress relief, and I'd like to think I'm semi-decent at it, is play tennis. And so this has come up, and part of the concern is going back to many of the points that Dr. Stoddard talked about, ventilation, in terms of the systems in indoor spaces. And the issue is in terms of, yes, you can, and I'll confess, I have played tennis outdoor. Actually, I played in the DC League this summer where we had strict rules. You had to have face coverings or mask. Whenever you were not playing, we were outdoors. But when you were playing your match, you could take your mask off. We did not share balls. It was recommended that you bring your own balls. You don't share balls with the other person. So precautions that were put into place in an outdoor situation. Now, the challenge is in the indoor situation in terms of the ventilation. And so, that's unfortunately the reality where we live in. And it may be tougher. But the challenge is balancing if we don't put in restrictions in terms of mitigating potential transmission in that setting due to the indoor space, due to the ventilation. The only other option is that we wouldn't be able to allow it at all. And so I think it's something that we will continue to monitor. I am preparing for the fall and winter season with the expectation that I will be wearing a face covering in that setting. And it's something that hopefully we won't have to do this for many seasons after this, but in the short term, we feel consistent with our guidance and recommendation of wearing face coverings in other indoor fitness facilities, that it's consistent with that guidance.
Thank you. Councilmember Navarro.
Thank you. And Dr. Gales, I'll be sure to remind my husband that this is what he's going to have to be doing. He also says to me that is his way of decompressing, and but he understands. And where he plays, they've also been very strict. You have to bring your own chair, your own balls, etc. But it is the times we're living in, and it's tough to adapt in so many ways. Very curious about the announcement that we heard yesterday regarding rapid testing available, hopefully distributed soon through states and then local jurisdictions. Wondering if you have any indication or any insights into what that will mean and when they might be coming down to us. In general, and I know, but obviously interesting announcement and something that I know we've discussed for such a long time, that if we could ever get to a point where these types of rapid testing would be available widely, it would make a huge difference. I've also heard, of course, that even with that number that was cited, that would not be enough for what the country needs, but just curious as to your take on that. And another issue that I know I brought up in one of our Friday meetings, and it's been now, I think, more and more, I've seen it in listservs, are people trying to figure out, hey, what should we do for Halloween? So if you have any thoughts on that, if you could share that, that'd be great.
Well, to answer your first question is we don't have any specifics on it. I think many of us were caught by surprise in terms of the announcement late yesterday afternoon. And in fact, we had a call with MDH at about 1:30. We have a Monday, Wednesday, Friday call with them for an hour earlier in the day, and no one had been apprised of what the federal announcement was going to be. can do. So unfortunately, I don't have any further details. My understanding, I saw an interview with Assistant Secretary Gerard last night, where he talked about the intention is that the rapid test would be rolled out to help schools reopen, and so the testing would be prioritized to teachers, staff, and students. And so from that perspective, we certainly welcome any additional capacity to be able to do that, because I think we've in some of our previous conversations, we've talked about the value. If you do have the capacity to do routinized standard testing on a regular basis, you can identify cases earlier and keep them potentially from coming into schools. And similar to, I think, the Los Angeles School District, they have implemented or looking to implement a wide scale routine testing platform before their kids come back to school. And we know that there have been in settings, some of the non-public schools have implemented similar strategies and have picked up cases for staff members, for example, before they've come back into the school setting, and have been able to isolate them before potential transmission. We have talked about in some of those conversations in a previous question with our colleagues at MCPS about utilizing a testing platform. So if there is a plan to bring teachers, staff, or students back in a limited capacity, that there would be a testing component to that. So those conversations are already in the works. I do want to, again, for the folks at home, emphasize something with rapid testing, because I think there's a misunderstanding on this. So rapid testing is a great mechanism to identify cases quickly. However, it still requires a confirmatory PCR-based test after you get your initial results. And so the challenge is, for example, when we're doing contact tracing now, if we find out that an individual has tested positive with a rapid, we have requested and required a PCR component to confirm that, and also to confirm a negative before we relax the provisions. Now, earlier models of rapid testing have struggled in terms of sensitivity and specificity. The hope is that the newer models coming out from the different manufacturers will have a higher level of both sensitivity and specificity, so that the algorithms of the requirements for those follow-up tests will be adjusted and not be quite as burdensome in terms of the requirements. In terms of Halloween, I know that there's a draft on guidance that is being worked on and has been looked at. I know the LNR team, I spoke with our senior administrator this morning, actually. That's why I jumped on the call late. We were having a conversation about it. So that guidance is in the works, and it will put out very similar to what has been put out so far from the CDC and others. It will look a lot like that in terms of guidance and reminders of the physical distancing and social distancing, face mask, and capacity limits to keep people safe.
Thank you.
Thank you.
Council Member Friedson.
Thank you, Council President. I will be brief here. Just a quick clarification. I really do appreciate all the work that has gone into finding a way to safely and responsibly allow service to midnight for restaurants, and I know a lot of work has gone into that. I've been in a lot of those meetings, and I think this has arrived at a good place, and so I appreciate that. Just wanted to get clarification since we're taking it up on Thursday. I know you mentioned that the information is going to go up, as soon as possible, potentially even today. Should they be applying now, and the approval may not, formally go through until the council formally takes this up on Thursday? Should they be waiting until the council formally takes this up on Thursday? What should the expectations be for the folks who are waiting for this?
My understanding is that the executive order is dated by when the executive signed it on Monday, and that it will take. You can go for 72 hours before you all approve it, so it will technically be in place. Once the permit is up, they will be free to seek the permit, and so long as they can meet the requirements, including having that staff person there from 10 p.m. to midnight, they will be able to operate. If it's up today, they could theoretically operate tonight. I can't promise that it'll be up today. I think if it's not today, it'll be up tomorrow morning. In which case, Wednesday, tomorrow, they would be, if they meet the requirements, able to operate 10 p.m.
Got it. So you're not waiting on the council to act. You're moving forward since it's in effect for those 72 hours, and should the council go in a different direction, you would suspend it. That is,
Can I just say
Yeah.
something?
Yep.
Just, Mr. President,
Yes, sir, Mr. Drummer, please.
I don't agree with that analysis. It's not effective until the council approves it. There's no 72 hours. The 72-hour provision has got to do with the county executive. He can declare an emergency, which is effective for 3 days. That's got nothing to do with this. He didn't declare an emergency. This is based on the governor's order, and it requires the council to approve it. They can apply, but they shouldn't start it before the council actually approves it.
But to be clear, and Andrew, I'll give you extra time because I'm jumping in on your time.
That's
but
okay.
To be clear, yeah. But to be clear, Mr. Drummer, they could go ahead and ask people to apply now under your guidance and what you're suggesting. Could they ask people to apply now so that if and when, and I believe that's going to be when, the council approves this, I'm not a soothsayer, but I think I can predict this one. When the council approves this, that the people who have applied, they could very quickly receive their approval from the county.
Absolutely, yeah. They can start taking applications, but they can't approve anybody, well, they can't go into effect until the council actually acts.
Right, that's fine.
Okay.
Mr.
Thanks for that
Priest, I'll give you
clarification. Yes, sir.
2 minutes.
Okay.
Go ahead, Earl. I didn't mean to.
and I assume, Dr. Stoddard, I don't know that ABS is on this call, but they've been intimately involved in this. And
Yep.
part of the discussions and meetings that I've been part of, and I assume that a proactive email and correspondence is going to go out to all the licensees to make them aware of what the process is, when they can apply, and how.
Correct. Just as we did with it's following the very same process as the expanded outdoor permitting space. We will follow the same process, which does involve correspondence with those restaurants that we have licensure with. I'll verify that today, and I'll make sure that we amend our language to what Mr. Drummer has said, and essentially the first night they would be able to actually implement would be Thursday evening.
Appreciate it. If you could send that along to us of what the different steps are, just so we're aware of what is going out and when. Obviously, this is an item of particular interest that we've received a lot of correspondence on, and so it'd be helpful if everybody in county government was reading off the same sheet of music, so to speak. Appreciate that. I would just echo the comments that were made before in the discussion about the indoor performances and arts organizations. Appreciate you looking into this. Obviously, there have been a lot of meetings and discussions on this, many of which I've been a part of as part of the recovery work groups. I know the county executive just met with some of the key stakeholders in this area yesterday. And if there is a safe way to do this, as we're looking at other jurisdictions, I hope that we will, identify them and figure out ways to get there. But, of course, only if there's a safe way to do so. So appreciate it. Thank you. And I'll yield my time back.
Thank you very much. You actually came in almost to the spot before I interrupted you. So
Don't get used to it.
I appreciate it. Thank you. I believe me, I won't. Dr. Gales, you actually could, if you'd like to make a presentation, we'd appreciate that as well.
Actually, we talked a lot about the things that I was going to update on today. We hit on the testing piece. And so the other key component with rapid testing, in addition to the federal announcement yesterday, as you know, several weeks ago, the governor announced that Maryland was participating in a multi-state group effort to get rapid testing. Again, as we find out more details, again, the 250,000 kits that were discussed are prioritized to nursing homes and assisted living facilities. And from my understanding, the work is underway to begin delivering those systems to those facilities to start testing. I don't know the exact date when they will start, but that is underway. And my understanding is that each facility will get an allotment of kits to start their efforts, and then will be responsible for forming relationships to be able to continue that testing capacity. And so as we find out more about that, we'll continue to update you. Separate from that, we have been looking into different vendors who would be able to provide rapid point of care testing on a large scale for the county, and we continue those conversations. We also continue conversations about bringing in additional vendors to be able to increase the supply of testing capacity here. Now, as we've talked about before, testing has been down across the board. For example, today of the state results, I think the tests were resulted out of 15,000 tests. Of those 15,000, 3,600 were from Montgomery County, which is a fair amount of tests from us. We continue to see, in spite of having capacity to do at lower test numbers, but they are coming up. Yesterday, for example, we tested over 760 people, I believe, as a part of the county apparatus spread throughout the different test sites. We had representatives from the state attend our Silver Spring Center to try to understand best practices as it relates to indoor testing and large high throughput testing options as they create a state system, and particularly as the weather gets worse and more sites are moving indoor and transitioning from those bases. So as far as the testing piece, we'll continue to update you on that front. We've discussed the cases in the non-public and public school settings. And we continue to work with community partners around developing our vaccination strategy. As we talked about, I believe it was Friday, I'm not sure if it was on our Tuesday call last week briefing, the state has received some skinny guidelines from the federal government in terms of expectations in setting priority groups. In terms of how vaccines will be disseminated when a successful COVID-19 vaccine candidate is put forth. And so what our team has been working on internally is coming up with completing a needs and capacity assessment to provide back to the state as we discuss a larger state plan. And in addition to that, we will be working on a regional plan with our National Capital Region partners, as well as a local distribution plan for us within the county. So those efforts continue as well. And we also have received as it relates to flu vaccines, we've received some new flyers from the state that we will be distributing. We are waiting for a version to be translated or provided from the state so that we can share and distribute broadly within the community. We will be bringing back the rocking horse site to be able to provide immunizations for our children to get them up to speed. Again, we're reiterating to parents at home, just because your kids aren't physically in the school building, they still need to get their vaccines up to date. Because when we do have kids back in school, which we are all hopeful for sometime within, well, I won't give a time date, we're hoping to get kids back in as soon as possible, as safe as possible. They're going to need to be up to date. So why wait? You can do that today. And we're partnering and working with the medical society as well around getting that up to speed, as well as the increasing flu vaccination rates within the county. Strangely, I don't have a ton much more to update. We've covered a lot in the questions so far. And, as always, want to say a special thank you to the teams from all across the different agencies for the continued sustained work that they're doing. In particular, I know Dr. Stoddard's shop and our LNR team have been working hard. All of the different programs we're talking about that are created, the guidelines that are put into place, they have been essential and central to making those efforts move forward. So special thank you to all of those who are involved there. I will stop there and answer any other questions that you all may have this morning.
Thank you very much. Councilmember Albanaz.
Thank you. And Dr. Gales, I didn't know you played tennis. We're going to have to go out and play these days. That'd be fun. So just start with positive feedback that we've received from independent schools who have really appreciated those weekly meetings and updates, and that they really do feel like the county has been a strong partner in implementing plans, addressing cases. And so I just want to acknowledge that and appreciate your efforts to make all of that work, because as we all know, it's critically important. I had sort of an abstract question. I know we are looking at ventilation systems and seeing what can be accommodated moving forward. I read earlier a couple months ago that there was a concern about restrooms too, and restrooms being a location of possible spread. Is that accurate? Is there any concern? Is there anything we've seen in evidence? We've received a couple of constituent questions regarding restrooms.
Honestly, that's doing on me. I think outside of the standard provisions in terms of cleaning surfaces and making sure everything is cleaned on a routine, regular basis. I'm not personally aware of any studies that have looked at restrooms solely, nor am I aware of, based upon looking at the contact tracing data on a weekly basis, if restrooms. I haven't seen restrooms being pulled out as a site of concern. Now, as Dr. Starr pointed out earlier, it's tricky. There's lots of different things. So if I'm in a restaurant, did I come into contact with it in the restroom or in the facility? So I think it's hard to tease out. Though that said, we'll have our team look into it, and if we whatever we find, we'll be happy to provide for further conversation.
Thank you. I appreciate that.
I can add a little bit to that. So the virus is found in most body fluids. So I won't be graphic, but just to say that restrooms, that would be the one place I would be more concerned. But I would say restrooms are great because they have hand washing stations that are built in by design. And so I would encourage people to wash their hands thoroughly when exiting the restroom. And while they're in there, just remember any surface that you touch is a potential contamination point for COVID-19 and other communicable diseases. And so I don't think that, we'll do some more look into this, but I don't know that I would be concerned about a bathroom in a way disproportionate to other public spaces.
Appreciate that. Covering a lot of bases.
Possible. Possible.
Yes. And sort of another general question, as the numbers continue to hold, and obviously we are correctly being cautious in our approach and deliberative in our approach as we look on a case-by-case basis for different organizations or industries to open. But as waiver requests are submitted, do you have any general advice, Dr. Stoddard or Dr. Gales, that would help an organization who is interested in submitting a waiver request to provide some general guidance, what you would like to see, what you would not like to see? I know we've talked in the past about just cutting and pasting CDC requirements from a website. Sure as heck isn't going to cut it. But are there examples that you might be able to give of successful presentations that have been made that might be a good guide for other organizations?
I'll take a start on this. So generally speaking, more people indoors for longer periods of time is what you're trying to avoid. I think that's the biggest thing. And no face coverings or any removal of face coverings, that's another box you don't want to check. In addition, so the other thing is that we really look for human behavior being what it is, we look for mechanisms, physical barriers, and process that encourage people to do the right thing. We don't like systems that rely on individual knowledge and or trust to effectively operate a facility. And so we're looking for places that have designated spaces for people to stand throughout the entire system. We're looking for places that have thought about physical barriers and protections. We're looking for places that really walk through every step of their business model, whatever that is, from the point that the person pulls up in their vehicle or walks up to the front door through when they come through your facility to when they exit. What typically we find in some of our proposals is that people think about their core business only and not about the ancillary things, the restrooms, the entrances in nearly a detailed enough way to think about those things. So thinking about how can I deliver my direct service, but not the more holistic approach to how you address them. And those are the areas that I think we find the most need for follow-up and questions.
Thank you. And I understand Councilmember Rice has one very quick follow-up. Please.
Well, and I'm actually not sure if it'll be Dr. Gales or Dr. Stoddard, but there's been conversations around foster care and children aging out of foster care, and whether or not, and I know there's been questions about asking Governor Hogan to actually do something to establish, because as children age out, obviously, in this time frame, it's not a good job market. There's lots of housing instability, all different kinds of things. And so it really would behoove parents, foster parents and children to stay together during this time frame. Have you seen any of this in terms of conversation? Is there anything within that Montgomery County can do outside of state regulations? Has there been any conversation with public health officers across the state? I'm just curious as to where we are there.
I confess I've not been a part of any of those conversations and aware of that coming up from a health perspective. I'd be happy to look into it and check with my colleagues and children and families.
Yeah, I think we can reach out. Our early child care work group, I think would have encountered this, and we can do some follow up to see what they've done, and we can follow up with you offline.
That'd be great. Thank you. I told you it was quick.
And it is. And I have to tell you, I believe that might have been, we've had a lot of good, important questions today. That perhaps is the most life-saving. We really do have to try to figure out what we can do for our foster care system. Well, I see no other questions at this point. Both Dr. Gale and Dr. Stoddard, thank you very, very much. I got you a tennis game here today, Dr. Gale. I mean, hey, got two. I mean, I'm telling you, so, it was well worth it for you to be here. Earl, I don't know. I mean, maybe you have to take up Frisbee or something. We'll see what we can do for you, okay? Thank you very much.
Be well, stay safe.
Do the same. We are going to be on recess until 1:30, where we have several public hearings. Thank you all very, very much for being with us. See everybody back at 1:30.